I try to encourage all of my patients to breastfeed their babies. There's a very few women who shouldn't breastfeed their children who are on either medications that could be harmful and delivered through the breast milk, or women who are HIV positive. That's a very tiny number of women. Most women can breastfeed, particularly women who receive support. And I try to encourage women to breastfeed not only for the sort of well-known maternal baby bonding, that's a pretty unique experience you can have, but also from the medical aspects of it. In October is Breast Awareness Month, Breast Cancer Month. We have a lot of flyers, we have a lot of drives to increase mammogram screening for patients, and it's a reminder for me to remind my patients that they're actually in control of some of their breast cancer risks. We hear a lot about obesity increasing your risk for breast cancer, and that's absolutely true. But one of the things that women who choose to give birth can do to dramatically reduce their risk for breast cancer is to breastfeed their children. And that's something that unfortunately in this culture we don't do very well. We have less than half of our moms leaving the hospital dedicated to breastfeeding, and at the 6-week follow-up, only about half of those patients are successfully breastfeeding. If they're not breastfeeding, then they're using formula. This is probably one of the craziest things that's come along, in my opinion, in terms of something that's been introduced medically in the last half a century and been so readily accepted with really little questioning by most women. I mean, physicians have questioned it, lactation consultants question it, but women aren't really questioning what the effects of not breastfeeding are on both their bodies and their babies. And it's a pretty simple, straightforward correlation. Breastfeeding reduces your risk for breast cancer. Now, a lot of women at 26, 27 aren't thinking about how to reduce their risk for breast cancer, but as a collective, that's something we should be talking to our women about, to our daughters, to our moms, to our friends. Hey, we're going on the cancer walk this week. We're doing this to prevent breast cancer. We're doing the Komen walk. All of these things women involve themselves in and engage in to try to promote breast cancer treatment and research. And one of the things that we don't hear very often is a campaign for breastfeeding being integrated with that. And that's one of the things that I really like to try to talk to my moms about, particularly women who come from a family with a high incidence of breast cancer. I try to empower them. Yes, you can do something to reduce your risk of breast cancer. It's not 100% reduction, but it's a lot better than anything else that you can do to actively reduce your risk of breast cancer for the average woman.